Good evening. Welcome to our final Whatcom COVID-19 Community Forum. We started this series back in January as our vaccination effort was just getting underway. In fact, just this week we celebrated 6 months of vaccinating our community. We've come so far, so fast. In January, we expected that it would be our summer or fall before the general public would become eligible for vaccination. And of course, as you know, as of May, everyone 12 and older is now eligible. But for many in our community, this moment has not come fast enough. We mourn those who have lost their lives to COVID, and we share the grief of their friends and families. COVID-19 is not done with us yet. Hospitalizations over the past few weeks were quite high, even as vaccination rates climb and our case rates start to drop. COVID-19 has taken a toll for local businesses as well. It has been, I don't even need to say it, a challenging year. But at the same time, our local businesses have shown remarkable resilience and ingenuity. From the early days of the pandemic to now, they've quickly adapted to changing circumstances. Tonight, we're focused on reopening. On May 13th, Governor Inslee announced that our state would reopen by June 30, just a couple of weeks away. He also said that full reopening could happen earlier if 70% or more of Washingtonians ages 16 and older initiated vaccine. Over the next hour, we're going to talk about what reopening looks like in Whatcom County and how we can continue to support each other in the days ahead. I am Erica Lautenbach, the director of the Whatcom County Health Department, and tonight I am joined by Barbara Chase, the executive director of the Whatcom Business Alliance, Dr. Erica Kreit, the director of behavioral health for Touchstone Health Clinic, Paul Hansen, co-owner of Village Books and Paper Dreams, and Guy Acciagrosso, president and CEO of the Bellingham Regional Chamber of Commerce. Before we turn to that discussion, as always, let's take a quick look at where we are in our vaccination efforts. So as you can see, we've made very good progress in the last month, and we are close to meeting the statewide 70% threshold that Governor Inslee has set as a vaccination target for reopening before June 30th. As you can see from the top chart on the right on that dial, we are at 68% in Whatcom County, which is just great, remarkable progress over the last 6 months. And we are grateful to all the hard work being done across our county to increase vaccination rates. We have 50 vaccination provider locations, including pharmacies, healthcare providers, and community partners that have stepped up to provide vaccinations to their patients and customers, to run mass vaccination clinics, and to pivot to organizing pop-up clinics like we've started to see in different areas around the county. We'd like to recognize the work of the partners and volunteers who organized and ran our community's vaccination center at Bellingham Technical College, which as of today has now suspended operations due to the dramatic decline in demand for that type of service and more of an increase in demand for those pop-up sites going to a pharmacy to walk in or going to a doctor's office. So we recognize that, and we're changing our models in order to accommodate the needs of our community. So that mass vaccination site has now been suspended. The volunteers who made that happen deserve our gratitude, and I want to especially thank our friends at Unity Care, CMAR, Family Care Network, Peace Health, Hoagland Pharmacy, Bellingham Technical College, Whatcom Community College for their efforts to stand this up, to staff it, to make it incredibly successful in getting more than 10,000 doses out to our community. So it's just been an incredible effort. I also want to particularly thank and share my gratitude to Lummi Nation and the Nooksack tribe for their generosity in making their vaccine supply available to Whatcom County residents, for their assistance in running vaccination clinics, and their help in getting their vaccination data incorporated into the state immunization system. The inclusion of that data has brought us very close to the 70% mark. Over 11,000 doses just from the Lummi Nation and the Nooksack tribe have been added to our state data that you see here in the last couple of weeks. So it is just a wonderful partnership. We really thank them for their efforts and their generosity with their vaccine and their staffing as well. That said, we do continue to see lower rates of vaccination in some parts of the county. We encourage everyone who's not yet gotten vaccinated to do so. Vaccine supply is now widely available. Most clinics accept walk-in appointments, and we know that the vaccine is very effective in preventing COVID-19 hospitalizations and deaths. As you can see on this slide, this is the total population of people who have been vaccinated in these sub-areas, but I do want to share that we talk about that governor's metric of reaching 70% of 16 plus. And I do want to share very positive news that Bellingham is now at 76%, so they have surpassed that governor's metric. And we have some jurisdictions that are hot on their heels. The Blaine School District boundary is at 67%. The Ferndale District boundary is at 66%, and the Meridian School District boundary is at 65%. So we look forward to welcoming those jurisdictions into the 70% pool very soon. And it's very exciting for our community to see such widespread uptake in the vaccine, as we know it's such a safe and effective method to get us out of the COVID challenges that we've been facing for the last 16 months. So with that, let's talk about reopening. The path to reopening has been dependent upon reducing COVID-19 case rates. With rising vaccination rates, we have seen steady declines in case rates to the point where it becomes much safer to reopen. In fact, just this week, we, for the first time in 2021, reached a level of case rates that was under 100 per 100,000. So we are making great progress in seeing these case rates come down and the burden of disease reduced in our community. So what does reopening look like? There are still unanswered questions, and we will surely get more information in the coming days from the state. But here's what we know. As of June 30th, if not before, Washington State will reopen. That means that most public spaces will be allowed to operate at full capacity. One exception is large indoor facilities that accommodate 10,000 people or more. Those will be limited to 75% capacity, but you can still go and see a concert or a sporting event and enjoy that with a large number of other people very soon. We also expect that public schools will be fully open for the new school year in the fall, which is a welcome change for our families, for our schools, for our kids, and for our parents that have been juggling childcare with working for the last 16 months. The reopening guidance does not mean that the state of emergency has been lifted, however. It also doesn't mean that masking recommendations have been lifted. Those remain in effect. If at any time the statewide intensive care unit capacity exceeds 90%, restrictions could be reimposed. But this is a significant milestone in the pandemic, one that we should and are celebrating. I'd like to start by asking our guests tonight, and this will be open to all of our guests. Thank you all for joining us, Barbara, Dr. Kreit, Paul, and Guy. What does it mean to you that we've reached the point of reopening? I'm going to start with this question with Barbara, and then I will just call on each of you so there's no confusion about who's going next. Go ahead, Barbara.
Thanks, Erica. I think as the pandemic state of mind comes to an end and we're adjusting to our post-pandemic world, I hear largely interest to get back to in-person meetings, getting back to social events, sporting events, the theater, going out to visit family and friends, and I think for a lot of our citizens, traveling across borders. And I know we are pretty excited being a border town that it looks like the borders are likely to reopen in the next 30 days or so. So we're looking forward to that.
Great. Thank you. Paul, what does it mean to be reopening to you? And Paul, you might be on mute. I can't hear you.
That's how my staff likes me best, is when I'm on mute. Thank you. Yeah, actually, it's just one more step back to our lives before and a sense of normalcy, as you said, Barbara, and being able to travel again and meet with our friends and family, again with our community partners and reforging those in-person partnerships. We just set up our first in-person partnership meeting with the Mount Baker Theater, so we're looking forward to upcoming events with them. And although even before all of this, our philosophy has been one of embracing change and keeping ourselves open to opportunity, this past year has really tested this beyond any level we'd ever expected. And we're very pleased at this point to see, now at this point of reopening, that we and our community weren't found wanting. So we see this as a huge success and very encouraging.
Yeah, great. That's exciting to hear about that new partnership. It's remarkable how many of those day-to-day, weekend, weeknight activities that we took for granted that we are just now nearly giddy to get back to, and really, really looking forward to having a summer where we can enjoy other people, the activities, everything that Bellingham and this region have to offer.
Yeah, just going out on the village green today, it was full of people, and
Oh,
lovely to see.
yeah,
Yeah.
great to see. Great to see. Now, I know, Dr. Crate, you have a somewhat different perspective given that you're a behavioral health provider, but what does reopening mean to you and your field?
Yeah, so I think it's important to recognize that what we all experienced was essentially this critical incident that, this whole corona experience has really impacted us in so many different ways. It's taken such an emotional toll, the stress, the losses, whether it's loss of people that you care about or loss of employment or loss of businesses. There's been so many losses, and we really can't even begin to process it because we're still in it. So I feel like reopening more is something that we're all really grateful for, but there still are a lot of things that are not going to be open. We're still, I'm up in Blaine and the border is still closed. The schools we're hoping can reopen, but I have 3 kids and they still hadn't been fully open for the last 16 months. And a lot of people are still working remotely, and there are a lot of businesses that aren't going to be coming back. And so I feel like we're still in it. But I am so grateful for things that have reopened more and to see things reopening more, because it means more connection, more celebrations with other people. Connections are such a protective factor that we lost during this experience, and has made it so much harder to be resilient. And so
Yeah, I often think about what happens when one of us is experiencing something very difficult and we have a support network, hopefully, that we can lean on to talk through things, get support, have conversation, and we're all in that place. We're all trying to hold on to our own sort of our own sense of how to have resiliency, and it's harder to lean on each other because we're all in that same place. So it's just a challenge, and it will be interesting to see as we start to come out of it what kind of clarity we'll have about the experience we've had in the last 6 months, or 16 months, excuse me. Thank you for that perspective. And I know we have some more questions for you that I think will be really helpful for our audience as well. So thank you. And last, Guy, what does reopening mean for you and the Regional Chamber?
Yeah, well, first of all, thank you so much for inviting all of us to be here, and kudos to the Veritas team for producing yet another amazing virtual format. I would say for me, reopening, it doesn't necessarily mean a point of normalcy, right? It's a transition. And I think it's a transition to hope. Like if I were pinpointing one word of this June 30th reopening piece, it's a hope. And it's a transition from fear, a transition from frustration, so that we can see the pathway to get back to a normal.
Yeah. We're not through it yet, but we are on the pathway, like you said. Yeah.
Exactly.
Yeah.
And just as previous voices have said, reopening means a lot of different things to a lot of different people, businesses, organizations. So we're still on the path, but again, I think it's maybe another societal reference over the hill, maybe.
Yeah. Thank you, Guy. So I want to move on to the next question, and I'll first start with Paul on this one. What excites you? And there's a little bit of excitement that's already been swirling in this virtual room about reopening, but what excites you most about the prospect of reopening? And what are your concerns about reopening? What challenges remain?
Yeah, well, what excites us is, golly, we're building community, and that's really what we do. I know that we sell books and we sell gifts and we have events, but really everything we do is building community, and it's really hard to do that without people. So we've done whatever we could during this time with our virtual events and giving people a chance to share and connect however we can. We're going to continue some virtual events with authors like Ishiguro, and we're having Stacey Abrams coming up soon with a virtual event. But boy, being able to bring people into our readings gallery and just having that full of people, being able to connect to readers and writers again is probably that excites us the most. Kelly's been doing home deliveries during this time on her bicycle, and she'll probably keep doing that because she likes riding the bike. One of the things that's coming up on the horizon very soon is the Schooner Zodiac. We do a book group at sea every year, and for 3 days we bring an author along and talk books and sail around the San Juans with the great Schooner Zodiac that's docked out here. And so that's coming up, and then we're going to come back and have our first Chuck on It Radio Hour after 18 months, and we're super, super thrilled to be having that again.
These are such great examples of the way businesses have been resilient and creative and innovative. You really have found connections with your readers and your customers in so many different ways. I love the biking story. Just connecting with people it's really neat to hear that. Thank you for that. And what would you say some of the emerging challenges or concerns you have about reopening are?
Yeah, it's kind of the same as when we were entering into this. I really like what you said, Guy, that this is not a finish line, it's more of a transition. And each phase has been a level of transition. And we've been looked to have the right answers when we're all just making this up together. So the biggest concern for us is reopening at the right pace, both for our staff and for our customers. We want to be able to serve all of our customers as they want to be served, but realize for some we'll be reopening too fast, for others too slow, and trying to read that balance has been a challenge from day one. And also, I think another big concern is the expectation that we'll be able to just hit the ground running and go back to what we were doing before. But for the past 18 months, we've had to reinvent ourselves in so many ways, and the things that used to fill our time before COVID went away to be replaced by the new things that we had to do during this time. And now those old things are going to come rushing back while we're still doing the new things. And so getting all of that in together is going to be a real challenge. And so we just look forward to a lot of patience from everybody.
Yeah, agreed. Thank you for sharing, Paul. Guy, what are you excited about, and what concerns or challenges do you see?
As far as the exciting piece, I think just as Paul said, like businesses, organizations, government has had to pivot constantly, not just a pivot, but a continuous pivot. Traditionally in the business world, we would call that innovation. And the continued innovation is what's exciting to me. And I know it's certainly scary as well. When you look at just over the first few months of the pandemic, I think the investment, I think this is a worldwide number, the investment in the digital economy, what took 4 months took 9 years before that same percentage growth. So we have a lot of tech investment. Great example, we're on a screen having this conversation all over the county. And I think that's probably the piece that excites me the most about reopening and kind of getting back to a normal is the innovation. Like what fun, cool things are coming out of this? And what are those things the business community, just as Paul said, there are some things that used to happen that some people may want, but it may not come back because there may be a better way to do it. And so that's the piece that's probably most exciting. The piece that's concerning to me, exactly what Paul said, is that consumer confidence and that consumer expectation is going to be it's going to be rough for probably quite some time. I guess another aspect of something I'm excited about is, again, just getting around people. Again, we had our first invite-only networking event just yesterday. And it's the first time the chamber has met outside of maybe 2 or 3 individuals in a year and a half. And it was amazing. And it was great to see people and engage with people and shake someone's hand, following the current phase 3 guidelines too. And which is, again, is something I'm not looking forward to do again. And that is something that I hope goes away.
Mm-hmm. Yeah. That's great. It's exciting to get back to some of those. And, our chambers are such great networkers and connectors of our businesses. It's so important that people and businesses have those opportunities. So it's great to hear that you're starting to hold events again. I want to ask Barbara the same question. What are you excited about? Concerns, challenges? What are you seeing? Also, can we all agree that pivot was a COVID word, and we're just going to retire that word after this year?
Agreed.
Just teasing you, Guy.
If I ever hear that again. But yes, I think now that the perceived risk has declined and mental health has improved, some say up 20% from the pandemic phase. Showing proof of the vaccine is a concern, obviously, for people. We're starting to experience that. Return to offices is slow. 1 in 3 employees still say that they are working remotely or plan to work remotely. So it's not just, the concern is not that you're just unlocking the doors, turning on the lights, welcoming back employees and customers, and then resuming life as normal. There's huge staffing issues. Workforce development is one of the prime concerns with our business members. We need a workforce. We need a group of individuals that wants to return to work. Summer help, that the seasonal workers, there's going to be another issue this year with workforce. So even with federal and state and local governments easing restrictions differently and the concerns around that, there's also a burden on business owners to make difficult decisions on asking for vaccination proof, asking for them to mask up. It was interesting. What does excite me is this return to economic development. There is tremendous excitement in our area. I'm pleased and excited to get back to meetings. As I said, we just had an open house a couple of weeks ago, and we were all social distancing because we're so used to it. And then I watched people come closer and closer together, and I think that really was very profound in that's what we are going to see. People will say, oh, that's right. We are safe to shake hands, to reconnect. And it just seems like it's been such a long rollout that people are are so used to living their life that way that it was wonderful to see and hear from business owners. There were some concerns that we were able to discuss, and we're just real happy to be able to be back together.
Yeah. Yeah, thanks for that. So many good insights. There's a lot wrapped up into this for our business owners, and, the staffing, like you said, and what to ask for from customers and employees in terms of masks and vaccines. There's a lot of additional layers on top of just trying to run a business that make it very challenging right now. So I can certainly appreciate that. Yeah. Thanks for that perspective. And lastly, Dr. Kreit, what excites you, and what do you see as concerns or challenges in reopening?
Yeah, I have felt so grateful for every sliver of reopening that we've experienced so far, and just small things also, like being able to be together with people and celebrate things. Last night I was at the neighborhood pool with my kids. It wasn't open last summer, and just seeing them be able to play with friends and experience joy and connection with peers was such a beautiful thing. I think small things make me feel really excited and grateful in a whole new way. I share similar concerns about how hard it is to reopen organizations in person because of all of the new rules, and politics and perceived level of risk is very different among people, and perception of what even happened is so different that it's a challenge to really come together in a way that doesn't seem weird.
Yeah, that's a great way to sum it up. How do we come together in a way that doesn't seem weird? Yes, yes, agreed. Yeah. Thank you for that perspective. I want to ask this question specifically of our business representatives in terms of coming back. What do you think we need as a community to come back strong? And I will start with Guy on this question.
Oh, that's a big question, right? And again, it's just as you and I often will say to each other, words matter, right? And when we're framing it, what do we need to come back? I don't think back's an option. As I said earlier, like, things have changed, structurally changed, and let's say Q4 2019, prior to the pandemic, wasn't in some essences an awesome place. So I think to come back strong, or to come out of this strong, there's some certain pieces that we need to focus on. Housing being one. Housing just got worse through this, and it wasn't necessarily directly linked to the pandemic because it was bad before. Childcare availability and affordability. Again, the lens was focused on it during the pandemic, but again, it was bad before. I think both Dr. Erica and Barbara mentioned the border, and as a border community, getting back to some normalcy, or getting to a new normal, will require that border to be open. So yeah, I think to get back, we need resiliency more than recovery. I wrote a blog article I guess that was probably a month and a half ago now, kind of outlining we need resiliency.
Yeah. Everything's a day or a year. So if it was a month and a half ago, maybe it was last year. Yeah. We don't know.
Yeah, exactly. It's digital.
It's a time warp.
Forever.
It's a time warp. And I really appreciate, I'm going to reframe that, because I appreciate you mentioning that. I know that we at the health department are conducting a COVID impact assessment. And like you said, Guy, where we were in 2019 didn't work for a lot of people. This was not a good place to live, even in 2019. So how do we change fundamentally our resilience and support for each other, and those kinds of things that you mentioned, like housing and childcare. This is not just family by family. This impacts our businesses, our
Yep.
our nonprofit organizations, our government, and all of the structures that support every single person in this county. So thank you for highlighting that. And for the next speakers, I'm going to say, how do we move forward in a way that is stronger? And I will ask Barbara to take this one next.
I wish I had all the answers, Erica. None of us do.
No.
You know, one of our mandates is to create a vibrant local economy, and that means shopping local. That means forgetting some of your habits online, as convenient as they were. We need bodies in stores. We need bodies back to offices. We need kids back in school so their parents can go back to work. I think there's going to be a huge adjustment come September when kids are back in school and they're having issues. They've had a really tough year. And then, of course, parents are only as happy as their unhappiest child, I once heard, and I never forgot it. And it is so true. And I think families have had tremendous struggles, as businesses have. There's been a shift in business focus to new models. Customers haven't paid bills. There's supply chain issues. There's lost income. Companies have had to take out loans that they're going to have to repay. So it's complicated. We've been through a really difficult time, and I think it's too early in the game to really wave our magic wand. We're going to have to go through this process and try and get people back to work. Let's get our workforce back to work. Let's get some restrictions that are in place lifted so that we can be open and have events and be networking and feel comfortable about that. I know there's a lot of confusion about what exactly needs to be done with vaccine certificates. Employers are concerned, obviously, about liability issues as well. Insurance coverage needs to be, looked at and brushed up on. There's a lot of issues getting back to normal. It really seems daunting for businesses. So I'd say as some really good, clear first steps, let's get that border open. Let's get people back to work. Every store I've been past has a help wanted sign in the front, and we just need to make that happen at a state level. Make sure that these lower skilled jobs are filled, because our employers definitely need bodies in those positions, and then really work hard on our economic development in the region. I know there is tremendous interest in our area. We need the border open before Southwest Airlines will start flying out of Bellingham. So it's very unclear and uncertain. So it's a little early in the game, but I would say absolutely get out there, shop local. Let's support Whatcom County. Let's get out and visit our friends and family and feel comfortable about doing that without anybody feeling shamed.
Yeah. Thanks, Barbara. I appreciate that. And last, Paul, how can we be stronger in our reopening and when we're back, whatever back is?
Right. Boy, Guy, Barbara, you really nailed it, and I'm not sure what more I can say except to add on to those things. So, Guy, I really liked how you framed it more in the community and how we're not going back, we're going forward. And we in our business and with our customers and our services, we look at the before times, we look at the during times, and we know that the after times are going to be a hybrid of both. And the innovations that we've brought aboard as a business, we're looking at incorporating these into our future model and using those innovations to expand our employee base. And be able to give people different responsibilities and more jobs that they haven't had before. We just hired 18 people in the past 8 months to bring us back up to full force of our 50 employees, because we see it coming back, and we want to be fully positioned to be able to take advantage of that. And boy, there's some smart cookies. We got some great people here. We're thankful for that.
Yeah.
Barbara, I love what you said about the local shopping locally, and I know that's an easy word, but it's a lifestyle. It's a decision. It's not a fad. It's a lifestyle choice. and deciding to invest in your community and keep your dollars local, it's a decision we make every day. My wife and I haven't shopped online, bought anything online for as long as we've been in Bellingham. We just don't. So I think keep stressing the importance of reinvesting in our local economy. Our business, we've always had online shopping in our store available, and it was especially needful to people who couldn't get out during this time. So we were very thankful that they took advantage of our online shopping services. It grew 800%. Guy, you were talking about how it's really expanded over this past 9 months or 18 months so much.
Wow.
But so the shopping online, a lot of people did shift to shopping online, but if they can keep that locally when they need to, please do. But yeah, we need the people in the stores as well. But then I think also to keep us strong, we have to continue to focus on our relationships. And Bellingham is a really special place. I've been in a lot of communities, and I've not seen a community like this with so many connections and this urgency, and it's almost a neurosis to meet one more person and do one more great thing. And if we can keep doing that, and the trying times that face us all these past 18 months, not just with business, but with activism and racial injustice and housing and all of these things, I feel like we were forged in fire, and hopefully we can come out stronger on the other side and keep a lot of the lessons that we learned along the way.
Yeah, such a good point. How do we make sure that we don't lose these lessons, that we don't revert back to old ways that didn't work for a lot of us, but really move forward in a really profoundly different way? So thank you for that insight. And my husband is from Linden, and you mentioned Bellingham, but we have so many unique and special communities in Whatcom County as well, and I know that you're also in Linden too. So I want to ask you, Paul, specifically about how you as a business owner are balancing the optimism about reopening with the specific concerns you're hearing from both your customers and employees. Barbara alluded to this beautifully, all of these challenges and complications, but you're in it, you're a business owner. How are you managing that?
Very carefully. We haven't made any decisions lightly, and we try to do everything very mindfully, listening to our customers, listening to our employees, listening to the governor, watching the what's going on, or announcements from the CDC. It's all been very mindful, and I think probably some people would accuse us of being a little bit slow on every step, but it's because we wanted to take our time and not have missteps. We just had a staff meeting with our 50 employees. It was our first in-person staff meeting after 18 months. And we all met in the Readings Gallery, and it was a great thing to see everybody. And it was, we did a ceremonial, if you're vaccinated and you've signed the affidavit, then you can take off your mask. And it was very scary for a lot of the staff, and they were looking around to see, is this okay? Can we do this? And they're slowly warming up to it. But we spent that meeting not talking about what we're going to do and telling them what our decisions are, but telling them we need to get ourselves ready. What can we do together to get there? And we presented the facts as we know them, talked together about what reopening will look like so we can envision that, talking through their concerns and adopting the policies to address them when necessary. The lens we've been using this entire time to examine the concerns is to determine whether they're about comfort or safety, and that we need to distinguish between those two when we're addressing the concerns. Safety comes first, absolutely, and comfort is a consideration. What's in our control, what's our responsibility, and what's not. We're proud to report that none of our staff caught COVID from working here this entire time. So they've been safe this whole time, and our policies have been sound and protecting them while working in a very busy environment. So knowing this, they've had faith in our decisions going forward.
Yeah, that's great. So exciting to hear the plans you have and how you're articulating that with your staff and working with them. I do want to say, and you mentioned this, but I want to give our business community a huge amount of kudos. We have worked with over 1,000 businesses in Whatcom County since COVID began, and so few of those, such a small percentage, resulted in an outbreak, which is 2 or more cases in 2 weeks, because our businesses were just so committed to keeping their employees safe, to upholding the safety and health practices. It's really, we're really proud of that partnership with businesses, and we're really appreciative of all of the businesses in our county that took these things seriously and really took their concerns of their staff seriously and put them first, and made sure that everyone was safe and healthy. So I just want to throw that in as well. I want to pivot just a little bit. I'm gonna say it.
You said the word.
I'm using it up. 2021 is the last time I will say it. So I'm going to use it until it's over. So Dr. Kreit, there's so much to unpack with this, right? I mean, we've talked about the health emergency. We've talked about the economic crisis that many of our businesses have faced. And you've also highlighted a bit of the crises of behavioral and mental health, and so much of what we've seen from surveying people, from talking to our providers and our nonprofits, is just the incredible toll and impact this has had on our community. And I want to think in terms of stepping forward once again, because we know where we are, but what are your tips for dealing with the emotions we feel even as we're reconnecting, right? Both the joy and excitement, but also maybe that trepidation or anxiety that all of our panelists have discussed at one point or another in just getting back out into the world. And then how can we practice some self-care in the coming months to sort of, be mindful of both the excitement and the trepidation?
Yeah, I feel like we really need to be mindful of just treating one another with kindness and dignity, and recognizing that we all went through something. And, connection is really what we're used to. We need to stay away from looking at our neighbor as other because they did or they didn't have the vaccine, or they thought this or they thought that. We need to remember to treat one another with dignity and kindness, and we all went through something, and the disconnection was really hard to get used to. It's not natural. It feels so much safer to feel connected, and we need to really nourish those connections and rebuild them. We feel better when we do. For self-care, I think it's always really important to do, meditation. Right now is a great time to do gardening, journaling, get your own counseling, do something creative, exercise. Just take really good care of yourself. It's been an emotionally exhausting year, so it's so important to make sure you are getting enough rest, and all of that pivoting does take so much emotional energy. As far as the anxiety, there are some awkward moments coming back, as far as how close do you stand to people? Do you wear a mask? Do you shake their hand? Are they going to feel comfortable if you give them a hug, or feel offended if you don't give them a hug? I always think it's just really important to ask people if they're comfortable shaking your hand, or with the masks, taking them off. Just talking about those things and how awkward this is and this situation has been. I think we all have fears about backsliding, especially with new things coming out about double mutants or Delta variants. We all have fears about going back, and just it's really important to try to. Some of the exciting things that have come out of this are we have learned how to connect better virtually. There are some things that have been exciting and that we can keep, and just people need to stay connected within their comfort level as they feel more comfortable and as things change. And but that is so important. It's such a protective factor.
Mm-hmm. How would you recommend, you alluded to this, but there's just been so much uncertainty, right? And we don't know what's going to happen next week. We don't know what things are going to look like. We may go forward, we may go backward. And that's been kind of the narrative of the last 16 months is there's no solid ground for any of this. How would you counsel or recommend we stay grounded in a climate and an era where there is no solid foundation? Even as we're moving forward and we're hoping that there's more foundation, but we don't know for sure.
Yeah, I think one of the things I've been practicing is trying to do a lot of mindfulness and meditation and being grateful for whatever phase we're in as we're in it. There's different special and beautiful things to be had about each one, that some of them were unexpected. And there's also different challenges, but I think just trying to live in the moment a little bit more is something that this has taught me personally, because we're not going to know. There's a lot of things we're powerless over. We're not going to really know how things are going to look in the future. But the moment is something that we can enjoy.
Yeah, thank you. So last question for all of you. There's a lot here. So how can we support each other to heal? What can we do as neighbors? What can our businesses do? And, speaking from your government, the health department, what can government do as we heal, as we move forward? So I'm going to throw this out. Let's see, we were just talking to Dr. Kreit, so I hope it's okay if I put you on the spot to start us out with this round of questions.
Sure, yeah. I think we need to just really recognize the impact, and whenever a really big incident happens, whether it's a trauma, or in this case, this has been sort of a collective trauma that we've all experienced in varying ways, recognizing, like Guy said, we're not going back, we're moving forward, and really recognizing the impact, how devastating it has been on so many people in so many different ways, is a really important path towards healing, acknowledging the difficulty and creating space for people to express that. Otherwise, it can feel invalidating and lead to more, conflict and people feeling triggered by the whole thing. So it's just really important that we recognize that, moving forward, things are different, and this had a huge impact on all of us.
Mm-hmm. Do you think this will make us more resilient for change in general, or do you think it will make us more resistant to change?
Yeah, I think that's a good question. I think just because things are going to be different moving forward, it doesn't mean that they can't be great or even better. But we are moving forward. We're not going back to what we had. I think adversity can definitely make you more resilient. It doesn't always make everybody more resilient. Some people, it hurts and they don't heal as well as others. But if you continue to focus on connection with others and focus on being really intentional about the way that you are coping with the stressors that you've had, those are ways to build resilience. Mm-hmm. Those are the path to resilience.
Great. Thanks for that advice. Guy, I'll ask you next. The many questions in my last question.
Yeah.
What would you say?
Gosh, I think my answer is going to sound a lot like Dr. Kreit and probably similar to Paul and Barbara, but move forward with compassion and grace. Kind of that mantra that I've been telling myself through this is, you don't know what someone else has gone through. Yeah. Like, there's been no silver linings in this thing. There may have been some positive outcomes, but you don't know if the person that you're looking at, talking to, shaking a hand now, they may have lost someone. They may have lost many people through this. So again, just starting with that compassion and grace, and again, moving forward. And again, I think a greater focus on equity and belonging, because again, there's a lot of people in this community that didn't feel like it was a great community. And I think it's all of our responsibility to make sure that our starting line is the same. And so maybe as we move forward, all of us share that again, that opportunities, let's say that. One of the things that has been really hard, and again, just to kind of get in that real moment, is it's been really tough seeing the shaming that had been going on. A lot of it online, and I think that's because that's where we were pushed to. I don't know of anyone who's ever changed their mind when someone said shame on you because of that, especially as adults. So don't shame. Don't break down others to make yourself feel better. Don't be a Facebook troll. Maybe that's a way to view that. And I think a really good way to do that is to listen. We have some amazing voices, experiences, people, cultures, businesses, ideas in this community, and listen to them. They're worth listening to.
Yeah. Thanks, Guy. I appreciate that you brought up the shaming issue, because it doesn't work. It doesn't bring us closer together, and there's no place for it in civil or compassionate dialogue or community. So thanks for bringing that up. I'm going to ask Paul next, and then we'll close out with Barbara.
Great. Thank you for that, Guy. Really, you nailed so many of the things that they really resonated with me. And the one word that I was actually planning to say was grace. So we need to extend grace whenever we can. And it's ironic because this is a time when we all need a little patience and grace, because we've all gone through this, but it's also a time when we're under so much stress, it's even more difficult to do so. So I remind myself that by extending grace and patience to others is actually a gift to myself, and it lowers my own stress. I guess that's the way I practice self-care. If I want to have more friends, I'd be a better friend, that kind of thing. So yeah, extending grace to others. I think grace, forgiveness, patience, listen, and share, all of those they're good qualities to do all the time, but especially now. Also, share your stories. We've all got stories from this time. There were a few anthologies of stories, people talking about what they were going through in the pandemic and how many of the shared experiences resonated with each other. And we've got stories that we'll be able to share. So storytelling is therapeutic. It brings us together through shared experiences. It helps us to work through our feelings, and it helps to figure out our lives and our place in this world. As a bookseller, you'd expect me to say something like that, but that's why I'm in this business, because I believe in the power of storytelling.
Yeah.
With businesses, what we can do is to reconnect, to help each other to address the challenges that each of us are facing. I think specifically practicing improv techniques, the bizprov, and if we didn't like improv going into this, we sure as heck like it now, because it saved us in so many ways. The day that we were told to close, we couldn't shut down. We just couldn't shut down. We had to take it, accept it, and turn it into something positive. And if we hadn't done that, we probably would have not weathered the first few days very well. But it was scary.
Yeah.
But you have to practice that. With the government, what the government can do, I tell you what, the government helped us out extremely this past 18 months. Not just with the PPP, that was wonderful, but our local government, we discovered resources and help that we weren't aware of before. And it's changed our business in ways that we had always aspired to, but didn't really have the bandwidth, and now we had to have the bandwidth. We had to address these things. We brought in a health consultant to double check and see how we were doing. And are we making wise decisions? Are we making good choices here? And they validated a lot. told us ways that we could improve, and from that we developed a safety committee. We formed a safety committee here that's working through the store and developing good emergency plans and getting good materials for us and making this a safer workplace. We were always safe, but now we're even safer. And now we put together an employee assistance program, thanks again to the local government. And this isn't a governmental thing, but all of the activism over this past year has changed our business and our industry, which has not been the most representative racially, and is, I think, that awareness, we've turned that lens back upon ourselves. And there have been some huge strides with book selling and with authors and with the publishing that will only make us stronger, and it's accelerated. Any strides that we were making before, it just really accelerated them, and we're extremely proud of what we've done so far, but we know there's a lot of work to do, and we're a lot more aware of that.
Yeah. Thanks for sharing that. And you said that you have great staff, and if they're hearing the values that you just articulated, there's no surprise that you have great staff. Thank you for sharing that. And especially about that grace and diligence in connecting with others. So thank you. And last word, Barbara. Oh, and you're on mute, Barbara.
Sorry about that.
That's okay.
You did such a great job covering everything. I just want to reiterate that we do live in a really spectacular location. We had and will continue to have a vibrant economy. I say, shop local, stay local, play local. I think the one thing we've all taken away from this pandemic is maybe a closer family network where we were all in close quarters for such a long period of time. I think that a lot of people got to know each other better than they ever had before, and I think that that's great that families have been able to spend that amount of time together. Again, touching on social issues, that's something that's been a huge concern, obviously, in our community, and we need to absolutely be inclusive and ensure that, maybe you go next door and say hello to your neighbor, and be community minded and support our local economy. I guess for the most part, we have an eclectic downtown. We are a port community. We have beautiful Vancouver and Seattle close to us. I mean, we live in an amazing location, and I think that this year we're really going to have an opportunity to enjoy all the fruits that has to offer. So it's been a tough time. I think we're really going to see with the end of relief of the true story of the economic impact of COVID. So we're really going to need everybody's support as we go through, a wonderful Thanksgiving and Christmas season in Q4, and hopefully we don't have all those Amazon boxes sitting at our front door this year, and we're able to get out and support our local community.
Yeah. Yes. Supporting the community is finding community again and connection with other people. It's nice to make eye contact. We can't do this on a screen, but making eye contact with people again is a treat. Those little things that we took for granted. I'd like to call up the last slide, but before I do, thank you, panelists. What a wonderful conversation. Thank you for your insight, and the heart you bring to the work in our community is just really admirable, and I've appreciated so much all of the partnership we've had over this last 16 months, and I hope that we can move forward together. So thank you. Thank you all. And if we could call up the last slide for a little more information about COVID-19, our Whatcom County Health Department site has lots of information about vaccine, about testing, about data, all the information you could seek, and links to other sites as well. And that's whatcomcounty.us/COVID vaccine, or covidvaccinewa.org, which is the state's website. So those are also resources available. And to our listeners and viewers, thanks so much for joining us tonight. It's been a pleasure to host these town halls, and I hope they've been informative and helpful for you, and hopefully entertaining as well. We look forward to moving forward, and in the meantime, please stay safe and stay healthy. Good night.